You are at QueerCast Live. We want to welcome you all. Addie, tell us about our guests tonight.
Well, tonight we're going to have Paula Thompson and Jill Gustafson. They are two behavioral health nurses at Mayo Clinic who I have the pleasure of working with. And we're going to be talking about suicide,
Okay.
and the epidemic that's happening in this country. There's just some really amazing, sad, tragic statistics around this.
Mm-hmm.
So we'll
Mm-hmm.
go over all that when they're here. But
Okay.
also, all throughout this cast here, core cast, you'll
Mm-hmm.
notice that the banner at the uh, bottom of the screen. So
Yep.
if anybody is at any time thinking about hurting yourself, please reach out for help. We're here. There's plenty of people here, lots of resources for you to connect with and talk to and be safe. We want
Yes.
everybody to be safe, right?
Yeah, we
Yes.
sure do.
And you'll see that the various numbers at the bottom. There's a specific one for trans community. That's Trans Lifeline, which will be coming up in a moment.
Mm-hmm.
And here comes Trans Lifeline right here. Yay! There it
Hey,
goes.
there it
Hey,
is.
so and I'm assuming that most people know that the suicide rate in our community is really high. It's higher than the national average, and
Mm-hmm.
really pretty unfortunately remarkable. But it kind of makes sense when you think of all the BS, the bullshit that our community has to deal with,
Right.
and especially
That's
the
right.
trans community, what they're going through now.
Yeah.
With
War
all the
has been
hate
declared on
that
them.
has been declared, and so we really got to look out for our trans people and provide support and encouragement,
Yes.
and um, yeah. So that's what
Yeah.
we're going to be talking about that tonight, and we're
Okay.
going to get into some unpleasantness around it, but also
Mm-hmm.
maybe look at some of the prevention strategies
Yeah.
also.
Yes. Let
Okay.
people know that they really are not alone. There's a
Yeah,
lot of support.
and that their lives matter.
Yeah,
And
for
they're
sure.
important, right? Yeah,
Absolutely.
everybody. So,
Absolutely.
what do
All
you think?
right. Well, I think that I'm anxious to hear what they've got to say.
Hmm?
And we're going to start out first
With
with
that
our
little news?
trans report.
Trans,
Yeah, and Akari is here
trans
to
update.
give you the latest news, good and bad, from the trans world.
Here we go.
Okay, I'm here with the trans report. Unfortunately, Garrett couldn't make it this night, so I'm just going to be solo. But we have two stories for you. So the first story is pretty local. It's about some of you may have heard that last Monday in Minneapolis there was a trans woman that was assaulted at a light rail station, which is pretty concerning. I mean, I'll say it right up front that while the police were worried that there was a hate motivation behind this assault, that motivation hasn't been established. So far, thankfully, it isn't a hate crime. It might just be a trans woman that was assaulted and happened to be trans. However, it is still quite concerning. There were 3 seen assaulting her, and 2 of those 3 people have been charged and detained. I don't know about the third. It was reported that she had a broken rib, a collapsed lung, and internal cranial bleeding, which is very much not good. Um, and so, as one of the things is that 2021 was one of the highest years for trans and gender nonconforming people dying, according to the Human Rights Watch. So, just these issues are definitely very concerning, and it's never good to have people in your community die. That's a pretty obvious statement. But thankfully, on March 3rd, Representative Leigh Finke said that the victim was in stable condition. So that's good. And there has been some legislative efforts coming out of this. So that's a good thing, is that, when somebody gets assaulted, you want to know that there's changes in society and laws to make sure that, more people don't get assaulted. So one thing is that Representative Brad Tabke has introduced a rider code of conduct bill for light rails. So again, a pretty minor thing that might not have necessarily prevented this incident, but it is good to make sure that people are being safe on public transport and aren't, being violent or rude to each other. Also, there's a 3-month intervention program led by county social services, agencies, and nonprofits that that would provide resources to support passengers on light rail stations that were suffering from like mental health issues, homelessness issues, or substance abuse issues. So that's another thing, is that you want to make sure you're giving people resources that keep them supported, so that not only are they not the victims of these things, but if this was a case where rather than being a hate crime, it was just, somebody hurting somebody else, you want to make sure that there's a community where there isn't that violence. So for our second story, it's that the first trans labor, the first trans MP in New Zealand, actually, she was a member of the Labour Party, died at age 65. Her name was Georgina Beyer, and she seemed to have a very impressive life. She was born, she served 1999 to 2007. She served 3 terms, and she was elected, an MP, so a member of parliament. And she achieved a lot of things in her life. She's been called a trailblazer by many people. When she died, the Prime Minister Chris Nipkins, commented about her, that he certainly thinks that Georgina has blazed a trail that has made it easier for others to follow. So she was somebody that not only was the first trans MP in New Zealand, which is significant in and of itself, however, she also set an example of empowering trans people. So she did a lot of things in her career. In 2004, she helped pass a bill that would allow same-sex civil unions in New Zealand. And later, same-sex marriage was also allowed. So, they've moved on from just allowing civil unions to marriage. So she was somebody that not only fought for trans issues, but also for the issues of the entire LGBTQ community, because as we keep learning, that when one part of this community goes under attack, then it's many parts of the community that suffer, and all parts of the community need to come together to support all parts of the community. Another amazing thing about her was that she made important progress in terms of laws around sex work. She was a former sex worker, and she was said she was dragged into the industry of sex work at age 16. And she passed reforms that made it easier, that sort of decriminalized sex work. And this made it easier for sex workers to get help from the police when they were the victims of violence, because that way they won't be punished by the police for letting their scenarios be known. They'll just be protected. So for her political contributions, she was named on the Queen's Birthday Honors List. And that's a list that acknowledges New Zealanders or Kiwis who serve their communities. And that's quite a high honor for a lot of people from New Zealand. So it was said that she died with grace, she really left a lasting impact. And, well, of course, a member of the trans community, especially somebody that influential, dying is sort of a sad thing. I think that her life is really inspiring, because we're at a time where there's a lot of fear and violence in this country and in this world that trans people are experiencing. And I think it's important to observe that not only can we survive this fear and survive this violence, but we can be influential, and we can reach these places, and we can help people. So, Georgina Beyer was not only the first trans MP, but she did all of these things. And it's just important to know that trans people are strong, and, there's so many influential trans people. And I think I'm really looking forward to a future where there are more trans, public figures and politicians and celebrities, just because that's what I see in my life, is that, my friends are strong, brave, and courageous people. And I'm I'd hope I'm a strong, brave, and courageous person. And it's good to see that slowly, influential positions are kind of representing that.
Yay, Georgina. Thank you, Georgina.
Yeah. So I don't really know if I have any other stories. That's about the end of my segment.
Well, thank you.
Oh,
Thank you, Kyrie.
you're welcome.
Thank you so much, Doug, for that. I really appreciate hearing about Georgina. I had not heard of her before, but we really appreciate all the trailblazers, right? Who laid the groundwork,
Yes.
right?
Yes.
Trailblazers.
Trailblazers. You and I are
I know.
trailblazers.
Look who's here.
Hi.
Oh my God, they've arrived
Hello,
in all
Jill.
their fabulousness. It's Paula and Jill.
Hi.
Hi, can you hear us?
Hi.
Okay?
You can hear us?
Yes,
Yes.
we can
Oh,
hear
okay,
you
great.
loud and clear. Hey, welcome to Queercast.
Yay! Thanks for inviting
Yes,
us.
right?
Yeah.
And just for total transparency, know that Paula's son is our tech guru,
Yeah.
hero here.
He said he's there
Oh,
right
yeah.
now. I
He
just
is
called
here
him
right
a
now.
couple
He's
minutes
talking to you
ago.
from another room.
Yes,
Yeah.
me and Bob work together and keep us going. None of this would happen
No.
without them.
Right. Hey,
Yes.
so for this evening, though, we're going to be talking about suicide, right? Not a very fun topic to talk about, yet very important, as the epidemic of suicide is just going on, exploding, accelerating. Hey, but let's start though, if you would please, Jill, Paula. Jill, we'll start with you. Just introduce yourself. You know what you do for a living, right? And why you're here tonight.
I'm here because of you, Eddie.
Yes, you are.
I'm happy to be here. My name's Jill. I'm a registered nurse over at Mayo Clinic. It'll be May. I'll be 18 years with them. I've always kind of had a personal interest in the mental health and addiction field. And when the spot came open in psychiatry, Paula recruited me in Bath and Body Works, and here we are together.
True story. True story.
Story.
Yeah.
Really? Bath and Body Works, huh?
Yes.
And I thought they just sold lotion.
I know. They sell psychiatry jobs too.
Nice.
But we really we always worked well together, and we both we really put the patients first. We love this population. So
Yeah,
hoping to make a difference. Yes.
Thank you.
Yes.
And Paula.
So, yes, I have been with Mayo Clinic too, almost 18 years. My date will be in September, and I'm a registered nurse in psychiatry. And yes, I did recruit Jill in the Bath and Body Works. Well, because I knew that we both have very strong personal interests in mental health, and we both have addiction histories, and both of our, we both are very, very much supportive of the mental health need, and we feel like we work well. We love what we do. We love coming to work every day, not only because we see each other, but we love the patient population that we work with, and always wanting to help.
Yeah, and I have to tell you, the commitment that you two express every day in the work that you do, I'm really an honor to work with you and be a part of the team there at Mayo Clinic and Behavioral Health. But if I can shift now into some of the statistics, if you will, I was doing some research for this, and I saw that the latest stats that are available are from 2021, and in 2021. 25 people in La Crosse County committed suicide. Now did I say 2021? Yes.
Mhm.
In 2020, 17 people committed suicide. That means it was a 50% increase.
Yeah, that's
in 1
amazing.
year.
Mhm.
Right? And that's what's
Yes.
going on across the country.
Yeah, that's scary.
What do you two think that is behind some of this? At least locally, if not nationally. What are your thoughts on that?
I think we kind of discussed this ahead of time too. A lot of it's the pandemic, I think, with the COVID and lack of social interaction and the media. Paula, do you think
Well, I truly do think too, because we didn't have that social interaction and a connection directly face to face with people and patients and your support system, just seeing your family. I mean, even just as personal experience, my daughter was stuck in Eau Claire at the time, and nobody really knew, like going to be seeing each other, or we're going to be able to touch each other and have that personal connection. So definitely, yes, the pandemic, I think, had a great, and social media is not always your best friend, and I think a lot of that was difficult for a lot of people, but also lack of access to be able to go and talk to people face to face. I mean, we all from a young age need that close interaction with people
Right.
face to face. And I think that's very important. And I think that that's part of why the numbers increased.
Yeah, the isolation from people,
Mhm.
most definitely increase in depression, anxiety, that all
Yeah.
leads to that.
Mm-hmm.
Yeah, how about that? And also, you mentioned social media is
Mm-hmm.
not always, and I know we didn't like talk about this as being one of the questions, but since that just came up,
Yeah.
social media has been playing a huge role in this, right? In the suicide thing, right?
Yeah. Yeah.
Any thoughts on about what you think of the social media influence on this?
Well,
I mean, we're
it's pretty easy to hide behind the screen, right? Like, so you can totally rip people apart that way and not know your effects on them. I mean, Paul and I talk all the time about the internet and how it's kind of ruined our lives because
True.
you
Yeah.
know, instead
I
of
mean, and Jill and I are not big social media people to begin with. I mean, we don't do that for those certain reasons. I mean, there's people that say things, and obviously we are people, we're human beings. We all are sensitive to what people say about each other. We overthink everything. I mean, that's a normal thing in today's society.
and you
We're
can read it wrong
And you
too.
can read it and imply it
Right.
wrong, even with a text message. I mean, you can, when you're not interacting, and I mean, as you can see, I talk with my hands. I mean, that's how I talk and communicate. So when you're writing something in a text message, or you're writing it up on Facebook, or you're posting something, people take things differently. And
Mhm.
I think it affects the way a person thinks, with their mental health. And I mean, we in general, I think as a society, what we say to people really has a long effect on their day. I mean, you go through the drive-through, let's say, and get a coffee in the morning. How you're interacting with that person in the drive-through affects their day or your day.
Mhm.
So it's
Mhm.
the same
So
thing with social
true.
media.
Yeah. And also, in social media, talking about that we were talking about the disconnection that happened during the pandemic, right? That happens every day on social media, right?
Yes, and in
And so,
fact, it makes us have a disconnect
right?
because we don't have to really interact with anybody face to face or in person. I might write something to you, Paula, and you might see it the next day.
Right, right.
So there's a disconnect,
And
even if
so,
we're communicating.
and that makes it easier for bullying to happen, for all
Right,
that, right?
exactly.
That abuse to happen. Hey,
And
Or an
that's a whole different,
obsession, like an
that's a whole
obsession,
different.
you're waiting for them to reply, and then you think, well, what's wrong with me? Why aren't they replying? And it's like, yeah,
Mhm.
leaves you in limbo.
So again, when we're talking about the disconnection, I just want to remind people, we said this earlier, that there'll be a banner scrolling throughout this segment this evening of various helplines, like 98 Suicide Prevention Lifeline. You'll see banner information for the Trans Lifeline, for Trevor Project, for all types of services that for if anybody is thinking of hurting themselves this evening or at any time, please reach out for help. Your life matters. We're here for you.
Yes.
These lines, these helplines are there for everyone. Pick the one that you think best fits for you. Again, I love the Trans Lifeline. That's there for the trans community,
Mhm.
especially given the assault that the trans
Oh my
community is
gosh,
under,
yes.
right?
Yes.
And so anyway, so please, anybody who's thinking of hurting themselves, please reach out for help. So with that, then, what do you think about the whole gun situation? Do you see that having an influence in this rising rates of suicide?
Well, we kind of talked about this too. I mean, in our practice, we don't see just, suicide from guns. We see overdoses more prevalent.
And
Intentional accidents, like jumping off the bridge or the bluff, and it's very controversy because I we don't come across a lot with the the gun situation, I guess.
I mean, it is something that we talk to our patients about that are suicidal as far as their access to guns,
Yeah.
but it isn't something that we see a lot with as far as the patients that we have, talked to or come across or have attempted or committed suicide as a gun, like Jill was saying.
So then also though, leading into that though, we talk about people jumping off the bridge is the mental health issue, right?
Right. Right.
So, obviously we're involved with services, right? Do you two see any gaps in the services locally, nationally at all that maybe that somehow we could maybe fill in or make things more accessible?
Oh, we have a huge gap, huge. Anywhere from the access to getting in to see a mental health professional in a quick manner, because we know you got to strike while the iron's hot, right? And so, if you don't have that help, it takes a lot of courage to come forward asking for help. So, I know like most healthcare facilities have waiting lists to be seen by like a psychiatrist, and
Or they have their waiting list. They don't even have a waiting list
Yeah.
because they just don't have
Taking any.
the staff. Yeah, they've just, we have a continual waiting list, but like Jill said, it takes a lot for a person to come forward and say, hey, I am really struggling. I need to see somebody, and then by the time they get to see somebody, something has happened between that time.
Yep.
Not always good.
Right.
Not always good.
Yeah, and that's an unfortunate thing. I mean, it is truly about access and the limited amount of like psychiatrists, psychologists, therapists that are in our community.
Well, and it's
And
a
it's
nationwide thing for the psychiatrists anyway, that it's nationwide that there's a shortage of psychiatrists, probably from burnout, which it's a high burnout rate for providers, but I don't know what they do to recruit them and encourage providers to get into the field, but we need it for sure.
Yeah, I wonder like what those numbers are like in med schools. But to talk about access, though, in doing my research for this evening, I came across something I had forgotten about, and that is the insurance companies are doing their damnedest to try to not cover mental health, especially at the inpatient level.
Right.
And United Healthcare is in the article that in this report that was done by NPR, they were singled out by NPR, United Healthcare, for their refusal to pay. They turned down a lot of requests for payments at the inpatient level and at the inpatient
for reimbursement.
Reimbursement. Thank you, Paul. There's just big words that go out of my head.
But I just can't even. We were talking about that too. But I can't even understand how that can even be legal, to be honest with you. I mean, I know that there is the in-network part of it, with insurance companies, that you have to try to stay within your network. But I've always thought in the past that if you are not able to be seen within your network and you do a referral, then you should still be able to be seen, and it should be covered and you should be reimbursed. But I don't know how you can legally I don't know how they can legally do that. I had not heard of that until you mentioned that. Yeah.
Oh, go ahead, Jill.
I was just going to say, with those who have, let's say, Wisconsin Badger Care, Medicaid, we find it challenging a lot of times to find them a bed. And we could send them to Mayo and Rochester, but they would, Minnesota won't take Wisconsin Medicaid. So there's that border and that lack of access as well.
And another piece to this that I know from what happens at like Gunderson and even our mental health facilities at Eau Claire and anyhow is that they allow the patient to get stable, but they consider stable, which means today you're suicidal, right? You're thinking tomorrow you're not. You get discharged because you're no longer a threat. And mind you, just less than 24 hours ago you were.
Right.
Well, and I have a big issue with some of that too. And Jill and I this is one of our big issues with patients that are inpatient is that they're really, I think there is a big gap. I really do. And I think you agree too, Jill, where they're not making sure that patient actually has a psychiatry follow-up appointment in a good time frame. There's times where we are in a patient's chart and we're like, oh, they were in for suicidal ideation 2 months ago that we were never even notified. So
No.
we would have tried to see that patient or at least done a nurse visit or something with that patient. So yes, there is a big gap with that.
Yeah, we
And,
can't see the behavioral health records from other
Right.
facilities. We have to get a release of information. And a lot of times these patients are hard to get a hold of to get that, or, like they didn't do their end of having a
Right.
social work follow up with us. And so,
Right.
I mean,
Right.
that's a huge, huge gap that needs to
So
be.
there is a lot of gaps, and we do try to work with different facilities in the area, to try to close that gap to make it a little bit better so we can try to meet the patient's needs in a timely manner. Because like you said, Eddie, they're there one day suicidal, and then the next day, all of a sudden they're safe to go home. And there isn't necessarily a plan in place.
Right. And they probably do that to get more beds open, which is sad because,
But
like,
a lot of our patients know that they've maybe been down that road before, and they have even told us, I know what to say. I've been there before. Yes, I was still suicidal. I was still thinking of harming myself, but I did not want to stay in the hospital. I wasn't comfortable in that place. And so then I told them what they needed to hear. They've told us that many times afterwards, because you're not establishing that trusting relationship with a provider that you've never seen in a short period of time in the hospital. So how can you trust them enough to be able to say your deepest, darkest secrets of this is how I feel?
Yeah, no, very well said. Yeah, thank you for that. And here's another interesting piece that came out. 70% of suicides in the United States are white men, right? White men, right? And then on the other side of that is the LGBTQ community, where our suicide rates run 2 to 3 times the national average, right? So you've got, when you think of white men, cisgender, white men, you think privilege, right? And yet they are the ones, really committing suicide that at rates that marginalized groups are committing suicide. And it's like, what is that about?
I've always wondered if they create their own stress and pressure by trying to get ahead, make a living, don't make a life.
All those kind of society
all
pressures
those
about what
kind of-
to be a man, that kind of
Yeah,
stuff, that kind of
yeah,
thing.
yeah.
What are your thoughts?
Well, we did talk about that. And that was one of the things we talked about exactly, is that sometimes I think you're brought up in this society as you are from this privileged family, as Eddie has said, and you're put on this pedestal and you're trying to be, something that maybe is not even attainable, and then you have that pressure on yourself of like, hey, I'm supposed to be this person. I can't attain that. I'm not getting support from my family. I'm only getting pushed, in this other direction. And then that makes it difficult, and which obviously in return causes anxiety and depression, which leads to thoughts of harming yourself.
Yeah, you're not meeting the expectations of those that love you. And so that takes you down a rabbit hole.
Right?
For sure.
It absolutely does.
And it's not always socially acceptable, unfortunately, to be able to say, hey, you know what I'm saying? I don't want with anything, you know what I'm saying? With your sexuality, with whatever, it's not always something that is talked about around the dinner table. Like, hey,
right?
Like we've always said too, Jill and I have talked about earlier, even today. So when we say to somebody, how are you doing? When you're at the dinner table, we really all pretty much are like, hey, I'm doing okay. But technically you're really not. You're probably hurting inside and you need somebody to talk to. And, that person, like we were talking about the percentages, people, I think we need to allow ourselves to have an open line of communication with our family and our support group that we are, that we know love us, and to be able to have that, again, back to that trusting relationship, that that it's a safe place, to talk freely about how you feel and what you're dealing with.
Without punishment.
Okay, Joe.
No, without punishment,
Yes.
Right.
Yes. I'm so glad that you bring up the piece about the family, because also some of the stats that I found was this particularly disturbing one. And that is 45% of LGBTQ plus kids, middle school and high school, 45% have seriously considered suicide. Because they've got, in my opinion, they've got, at the family dinner table, that stuff, they can't be themselves. They can't talk. All kinds of pressures going on, right? And any thoughts that you guys have about that?
I have a 13-year-old, so I get it. It's hard enough to get information out, the way it is, but I can only imagine, I mean, this goes back to how our kids are being raised nowadays too with the social media, I mean, who knows what's going on behind closed doors. And so I think there's a misunderstanding that maybe the parents don't understand what the children are going through, like as we were, being raised. And I mean, it's a whole different world,
Well, and even what type of questions to ask your children.
Yeah.
You know what I mean, I think that whole like resources for families and educational piece sometimes can be missed too. Like how do I mean, I think in general, raising a family is hard.
Yeah, right.
It is. It's hard. You want to, again, I think allow for that open communication, trying to make like back to that trusting relationship. I can't emphasize that enough. You want your child to be able to feel comfortable to talk to you. Now, how to do that? That's something that is a very, very difficult question. It really, really is, because every family dynamics is different, for one thing. Not everybody is sitting down at the family dinner. Not everybody is communicating with their children on how their day is. Back to the social media, a lot of children are like this all night long on their phones. They're not allowing for that communication with their parents and their family. And, again, that face-to-face dynamic instead of, I mean, I've been to family get-togethers. No, I would never allow this, but again, you're sitting on the couch and you're texting each other. It's like, no.
Isn't that fun? Yes, I've seen that.
It's true.
I've seen
In the
that.
same room when you text.
Yep.
You can't.
Yeah. Mom, can you bring me a towel?
I know. But again, I mean, it's just, it's sad, because we do really, really, really need to have open lines of communication with people that we care about, and be able to feel comfortable to reach out when you're struggling. I mean, it's really a difficult thing.
And we got to keep, I think as the listener, we got to keep an open ear too, and and be like benign intent, like
right.
just being able to I don't know, just being able to listen and not judge.
Yeah.
And validate
what they're feeling.
Yes, validate what they're feeling and what they're, I mean, I know Jill and I, when we do a lot of it's difficult in our job, I feel one of the most difficult thing is to really do a true, really good assessment over the phone, because you're not having that face to face, And so a lot of that is listening, validating what they said, to making sure that we understand what they've said is what they're saying. I mean, it can be difficult, and sometimes it's hard for that patient. You have to ask the question the right way, or to anybody, you have to be able to ask the right question, because it's hard for them to sometimes understand what we're asking. So sometimes you might need to ask it in multiple different ways, like you would with a child, like you talking to your 13-year-old. It's kind of the way you're wording it, like
where it's not threatening,
right.
Yeah.
You don't want it to be a direct question. You want it to almost be, an open question,
open-ended.
Open-ended. Yes.
I've seen so many cases where, just like when somebody's grieving and you say to them, I think it's time for you to move on. And it's like, well, no, you want me to move on because I'm making you uncomfortable. Same thing if somebody says that they're feeling suicidal or they want to hurt themselves. And people will come back with like, oh, but you don't really feel that way, do
you
you?
shouldn't feel like that.
Yeah.
Just kind of fluffing it to the side.
And it's because the people can't stand to hear about it. They don't know what to say. If, we had a situation in the summer where our son, who is usually just kind of whatever, he's just perfectly fine with everything. And all of a sudden, he started feeling suicidal. And we were flipping out because he didn't want to talk about it. He said, I know you're not judgmental. I know that, you're not going to think bad of me, but I just can't tell you this. And we were trying everything we could, and we aren't judgmental at all. I mean,
Sure.
the kind of stuff he tells us, you're like, no, I don't want to know that. But when he was saying all of this, we didn't know what to do. We wanted him to go talk to somebody. He didn't want to do that. We wanted him to talk to us about what was bothering him. He would tell us that something really big, I guess, was really, but he couldn't tell us.
Mhm.
And I
To
mean,
find that,
yeah,
that need to find that safe space, right?
right. Well, and he never would tell anybody what it was. None of us know to this day.
No, it makes me wonder though about these helplines. Like, it's interesting to have a space like. I don't know what your son. I mean, I know him, but I don't know how he identifies all that. But like
Yeah.
to have like a trans lifeline hotline, to have an LGBTQ hotline, to have something that
Yes,
is
because
for
perhaps he would have called us if he
something
didn't
that
have to look face to face as somebody.
Right.
He might have said, "We just have no idea what it was." And
it's scary. It's very scary.
yes, in that time of his life, whatever that was, did pass. He's working and in love now, and all those kinds of things. But it was
Like
something. It was something that he did,
Mm.
and he just couldn't tell us, even though he tells us everything. And so I wish that I had thought to offer him one of these lifelines, because he might have called them.
How about that? Yeah.
And we were
Well, and I
terrified.
think you can text on the 988,
Yeah,
which I think is
yeah.
a really great option.
Especially with like this age group with the
Right.
social media. I mean, that's safe, to
They
text
also,
it.
also is a chat line, which is 988lifeline.org.
Right.
You can chat.
Mhm.
Nice.
See, we like these hotlines for situations like this because, like it's hard to tell a family member or friend and you don't want it to be leaked out. And calling these hotlines, they're confidential. You don't know the person, it's a safe place, unbiased opinion,
Right.
Mhm.
They will listen. They will validate. Yeah.
Yes. Yes.
Exactly.
And they're
It's just-
professionals, so I mean, there's some education
Exactly.
behind it.
Right.
So
Right.
I want to talk to you, but I just want to run through some. I'm a little stat person, so I'm going to bore you all with some stats.
You're such a geek.
And this is in trans. I really am in so many
Yeah.
ways. Closet geek. Well, now I've been outed. I guess I'm not
outed,
closet
sorry.
anymore. Okay, we got that covered here. But the Trevor Project did a lot of good research around this, and transgender and non-binary youth considered to have the highest rate of suicide in our community. Transgender boys and men, 58% have considered suicide, 22% have attempted. 22%. Non-binary, genderqueer, 53% have considered suicide in the past year, 19% have attempted it. The transgender girls and women, 48% have considered it in the past year, 12% have attempted. Those who are questioning, 48% have considered suicide and 14% have attempted suicide. In the cisgender population, females, 37% have considered it and 10% have attempted. Of cisgendered boys and men, 28% have considered, 6% have attempted it. But I bring up these numbers again just to show the discrepancy that happens.
Yeah.
And by the way, if I go a little bit further in my thing here, Native and Indigenous people have the highest. They are. It's amazing what's going on. Of all the minorities, 21% in the past year, Indigenous people have attempted suicide. Where in the Black community, 18%. Those who are mixed race, 17%. So again, these numbers are higher in our marginalized people.
Yes.
Which I think also speaks again to that piece of disconnection that we saw happen during the pandemic, and things got worse. So these groups that live in a disconnected to the larger society are more prone, they're more vulnerable for suicide.
Sure.
Right. So with that, what do you think about prevention? Obviously, we have our suicide prevention summit every September, right?
Mhm.
And there's been all kinds of research into what works, what doesn't work. The jury is still out because, look, suicide rates are going up, and yet we're all doing our damned best to try to,
Mhm.
treat people with these issues, and yet it's not working to some degree. What are your thoughts?
Mm. Well, the more suicide prevention, the better. I mean,
Yeah.
I think it takes, that it takes a village kind of thing, the education piece of suicide definitely needs to be brought out there more often to um, alleviate some of this burden of going back to how families are able to communicate, how friends are able to communicate, how we can get access to better um, facilities in a timely manner for when patients are struggling. Um, I mean, Paula, I know that you are involved in the mini donut.
It's
So,
that suicide awareness
yeah.
event that's in the fall. I think that's an excellent event. I mean, I know that we try to do as much as we can. I mean, with educating and I mean the resources and all of that. But a lot of it true is like Jill was saying, the access. I mean, we've talked about different things in our little area that we work in as far as how we can provide that where we have a patient call that they don't have to feel that they have to go to the emergency room. Okay. Because again, they do feel that, hmm, what am I
Well,
looking for?
stigma,
Yeah,
the
that
stigma
stigma
in
as
the
far as
emergency
like,
room,
I don't know those people. And we were trying to talk about something that we could have, like maybe in our department where we have a patient that calls that they can actually just come in and see us. I mean, that would be something because they know us or, and then they don't have to go that other way. Or if they've already reached out to, let's say, mobile crisis, the 988 or things like that. But a lot of it is back to this, the local community events that we try to do and we try to support open communication, um, decreasing some of those accessibility that they have that they may be as far as like stockpiling medications, let's say, trying to prevent that from happening at home, or you know what I mean, having that. We really try to be good about allowing them to come to us to dispose of their medications. We have a process for that so that they're not having to be like going, you know what I mean, to a pharmacy or being embarrassed and having that whole stigma behind that, making sure that they again, back to the guns that we talked about earlier, or, you know what I mean? Trying to decrease that availability to them somehow. I don't know how, but something like that.
it's
But
just the education piece,
yeah,
getting people aware that it's okay to not be okay,
right, right.
and expressing those feelings and getting help for it. Because I think if more people were forward about suicide and the level it's at and the needs, I think that our access maybe would be looked at differently
Mhm.
if people weren't so quiet about it.
Yeah. Well, one of the wonderful things that is happening is that we are teaching people more coping strategies, coping skills, as the
Mhm.
awareness is happening through like Mini Donut, the
Mhm.
Suicide Prevention Summit that happens,
Mhm.
and so that awareness is increasing, that stuff is going on. Also, I'm looking at some of the prevention strategies that I found here, and a lot of it we talked about, fostering connections, fostering, a sense of belonging in people,
Mhm.
and improving access.
Mhm.
Improving access, that, as we've already mentioned, has been across the board in the United States, right? That
Mm-hmm.
the I guess, in terms of, how can we? Do you see any way that we can lessen harms going from here into the future? I mean, I know you talked about like how we can kind of get around this shortage of psychiatrists. Any other ideas for lessening harm?
Well,
Yeah.
I think there could be more education. This goes back to my own addiction experience here, but addiction and mental health and suicide go all hand in hand. I think that if we can educate some on the substance use disorders and how that can affect our mental health, and get access for those who are struggling with substance abuse disorders. That would be most beneficial. But it's really hard as a nurse to be able to have these people come to you and ask for help, and then you have nothing to offer. I mean, Paula, I don't know if you experience the same thing, but like in my past, I did a lot of primary care, and I always had a provider I could offer same day appointments, or within the week, and now it's really difficult to be able to provide that instant care.
Well, because like we said earlier, it's that you when a person is reaching out, that is so difficult for them to do to begin with. And then we want to be able to provide something for them at the time they're reaching out, whether it be they're just reaching out for the very first time. Hey, I don't know what I'm feeling. I'm feeling like this. I don't want to get out of bed. I feel like I don't want to wake up tomorrow. You want to be able to, when they're actually expressing that, like Jill was saying, be able to offer them something, because that is part of, to me, validating their feelings and how they're feeling at that time. And they might not a week later, I mean, it's, and a lot of people, like she brought up addiction. That's a good point. I mean, as we all know, a lot of people don't associate addiction with mental health and the whole hand in hand, and having two different, sometimes we're compensating for something else that's going on with the addiction part,
Right.
and then of course that's creating the mental health, concerns that a patient may have.
Sure. Yeah. I also feel like, that the more we keep talking, the better it's going to be, right? We're still trying to figure it out, right? The need for parents to know to get involved with what their children are doing online. To see that, because sometimes
for sure.
teenagers
my
will
God.
talk about suicide in their group online, and mom and dad or nobody knows that's even that they're even talking about this, right?
Or even the online bullying.
Yeah, right. All that.
Oh yeah.
I remember there was a teenage girl that committed suicide because of the bullying that she was getting online.
Oh, right.
Can I share something?
Yeah.
This is a proud mom moment. So my daughter, is got friends on her Snapchat, and one of them is her cousin who lives in Michigan, and my daughter visits Michigan every summer and has made some friends out there. But so one night this girl snapped her and just said, I'm not doing well. This is the stuff that people are sending me. And she showed me these snaps to this girl, not to my daughter, but go kill yourself. Nobody wants you around here. This girl's 13 years old. So I reached out to my sister-in-law. I'm like, hey, do you know this girl? Can you get in touch with her mom? She's like, absolutely. And come to find out, this girl had a suicide attempt like 4 months earlier. So she's like, thank you for letting me know, because she didn't have any clue.
Wow.
See, powerful. Thank you. Thank you, Jill.
Yeah. I mean, it's just, I think my daughter, because I'm like, you could have saved her life,
she probably did, and she could have just not said anything at all.
Right.
But she did. She took steps immediately. And that might be the other thing, too, that we have to do, is try to educate our kids on how to help each other.
Right. Exactly.
What to do if you know that this is happening.
Yes, there you go.
If somebody's feeling this way, do something in terms of education programs in the schools.
Right.
And
that safe space. Like my daughter felt safe to come to me, that I was able to go to find the mother and say, hey, because I mean, like Paula said, every family has different dynamics, and so talking about it, somebody can let on, and get inside.
And I don't know how much education is being done in this school. I mean, my kids are obviously older, as you know, so I'm not sure as far as nowadays what type of education is being provided in the like middle school, high school level, and even elementary school, like talking about people harming themselves. You can.
Right, Paul. No.
Yeah, I mean, I'm just not sure. Like what is and what age do they start talking about that? Because I mean, I
Curious
would
to
hope
find
that
out.
they're starting it at a younger age because, like Jill said, people are on social, they're on social media now at such a younger age that people have cell phones when they're 7 and 8.
Yeah.
Who knows what type of websites they're getting on or what type of searches or what type of
True.
things are popping up,
Yeah, they do teach it in the middle school too, Paula. I know.
But do they do it at the elementary age, like as
The
far as,
suicide.
well, talking about, even just talking
They
about
start that
harming
in 6th grade, I'm told.
6th grade, okay. But
Yeah.
there's people that harm themselves in different ways, and that's a whole other thing. But
Yes.
yeah, I just wasn't sure what age group that started now.
Yep. Yep.
Because it's always been something you don't talk about, I
Right,
think.
that's
Right.
exactly it.
Think
You
about
don't
that.
talk about it. Yeah.
And
Mhm.
the fear of even mentioning it.
Yeah, that somehow mentioning it might cause somebody to want to attempt
Or
suicide.
not talking about it won't make it happen or won't make it
Mhm.
exist. That's, I mean, I think that way of thought has fallen by the wayside a little bit, but not enough.
Mhm.
Enough. It needs to be brought
Right.
up.
Hey, before we go, I just want to bring up one other group, and because we haven't talked about our veterans and the suicide rate in veterans, right? It's something that at the very least needs to just be aired here for a moment.
Yes, I
Not that
agree.
we don't see a lot of veterans in our practice, do we? Do you?
Not. There's some. I
We have,
mean,
I would
Right.
say probably less than 5%, but we
Yeah.
do have some, yes, with a lot of
a
PTSD.
lot of them go to the VA though, so
Yeah,
they
yeah,
have
yeah.
quick access and free medicines and all that, free
Mhm.
visits.
I just didn't want that group to go unmentioned tonight.
Right.
That's good. Yeah, they
because
struggle a lot.
Mhm.
yes,
Me too.
a hell of a lot, and I for those who most of the vets have a hard time reaching out for help, but still,
absolutely.
Well, I'll use the example of my dad. I mean, he was born in 26. I mean, he's since passed away in 2010, but I mean, up until the day he died, he was a World War II vet. And, he was having major nightmares still up until the day he died from his days in the war, and so
And that wasn't acceptable to
and
talk
that
about.
was not
was it?
acceptable to talk about. He wouldn't talk about it and yeah, so I can't even imagine, you know what I'm saying? I mean, nowadays it's way better, but back then too, I think what we have available now is better. Like you said, Deb, people are talking about it more, but I don't think probably enough for what people are exposed to.
Mhm.
Right. Right.
Yep.
Hey, and any closing comments you have about all this for this evening?
No, this is fun. This is great. I
I
love
think
it.
it's been really helpful, right?
I think so. for
Paula,
sure.
anything closing comments?
No, I mean,
I
I
think it's a
think the only
wonderful.
other thing, I think this is great. Thank you for having us. I
Yeah.
mean, I think the only other thing too is we do want to encourage families that have lost someone to suicide, that it is really, really important to give yourself permission to take the time that you need to grieve.
You
You
have that
can't
feeling
emphasize
of
that
guilt
enough.
and yeah, you're going through the transition, like the
And
new
it's
normal.
right. And it's okay to be in the muck in between the transition. I was
Yeah,
telling
that's
people
one of the things that-
I went to this wonderful retreat last weekend, and Paul and I did, and we learned about transitioning. And I think it's very important that people who have lost a loved one to suicide know that it is okay, that you don't need to be okay with it right away. It's okay to be where you need to be and take that time.
Yeah.
Mhm.
I'm glad you brought that up because we didn't talk about those who
are
love
left.
people who
Are left behind.
left behind.
Yeah. Yeah.
Yeah, very good.
And we've experienced that
Yes,
with
we have
Right.
here.
people here at the center.
Right.
About one person a year, which I think is a lot.
That is a lot.
Yep.
Yeah, it's rough.
It's
Even
heart-wrenching.
I could imagine somebody's family.
So again, I want to thank you both for being here. And really,
Yes.
it's really
Thank
wonderful.
you for asking us.
I appreciate your
We may have you
commitment.
back.
Yeah, we're gonna probably have you
Please
back maybe in
do.
September, right? For time for mini donut and suicide.
Yeah.
Oh yes, I can come
Yeah.
back on and help recruit for that.
Yes,
Yeah.
absolutely. Let's do that. Let's plan that.
I'm
Yeah.
still waiting
Right?
to wear the fairy wings, Eddie.
Oh yes. Now that's my tip fairies. Future tip fairies are right here.
Yes.
And for
I'm
those
going to tell Joe.
yes.
Yes.
So you think
I'm
you
all
can
for it.
bag. Oh my God. I'm gonna have to break out a dress.
Yes, so
Yes.
I have pictures of him in one. So
Ooh, I
Oh,
want to see
yes,
those.
you never,
No.
I do have that. I remember you did that one event that one summer, and then it got, remember when it was so hot? Do you remember that?
right.
The drag
The big
race.
race.
Oh
Yes.
God.
That's when I saw you in the dress.
Makeup
I
on. just
wanna
wore
see
big hat
Eddie in a
and sunglasses
dress.
and lipstick.
Yes.
A big floppy,
A big
flat
floppy hat.
dress.
Yeah. And a
Oh.
sundress. Very fun.
But
Yeah,
that
it
was
was
a lot of
that
fun.
was-
You should do that again.
Yeah,
Yeah.
it was the drag
We
race.
should.
That was a fun event, wasn't it?
It was. And you're right. It was so hot. We
thank
had to take it down from 5K to 1K.
You
I
sure?
remember that. Yes.
You
I
sure?
remember that. And I was all gung ho. I thought, gosh, maybe I can actually run it this time.
No,
It was so.
it was so hot. Our insurance carrier, it made us cut it in half. Cut it
Did
Oh,
you
short.
did you
They
run
didn't
in
wanna cover
heels?
it.
Did you run
Yeah.
in heels, Eddie?
Yes,
Did you-
of course. Of
I'd
course.
love to
Backwards
see
what
that.
even.
beautiful long
Hey,
girls
who are you
out
talking
there.
to?
I love that. I'd love to
Yeah.
see it.
Yeah.
I break my ankle, but I'll run.
As long as you're pretty, that's all that matters.
Thank you.
Eddie's
Yes.
always pretty.
There you go.
Mhm.
Always.
That's
He
right.
is. Yes,
Yes.
Fashion knows no pain.
No,
exactly.
there
at
is
least
pain
ignores
with
everything.
beauty. There's
Yes.
pain with beauty.
Yeah.
Hey, thank you. Thank you for being here. I love you guys.
Yes,
you
Yes,
I
both
love
thank
you
so
you
too.
much.
so much.
Thank you for having
Bye.
us.
See you tomorrow.
Goodbye.
Bye-bye. That was good. That was
It
wonderful.
was wonderful.
You did a great job. We're